Welcome back. We're talking with Dr. Kerry O'Reilly about pain elimination through the latest techniques in dental care. All right, Dr. O'Reilly, before we went to break, we were looking at basically what metal fillings can do to your teeth over time. We talked a little bit about maybe some health concerns with them. Nothing's proven, obviously, but just common sense reasons.
Yes.
Let's talk about what you can do, both aesthetically, cosmetically speaking, to make it look better, and then to make the tooth actually stronger, because the composites, they bond with the tooth, unlike the metal, don't they, and make it a little tougher?
That's exactly right.
Okay. Let's take a look at the picture you brought, because I think this kind of will explain it for everybody. Tell me what's going on in this photo here.
Okay, you're right about the new materials. They are improved. They've improved over time so that we can bond a tooth and support it and hold it together.
All right.
And remove less tooth structure in the process. So in this case, we have a patient who had 3 silver fillings side by side. And this
so you've already removed the filling from the center one.
Exactly. That filling is gone, and what you see there is a little bit of a protectant layer of composite that's been bonded in to protect the tooth.
Now, will that seal the root?
That does seal the tooth,
All right.
again, and protect the nerve.
Just real quick, with the metal filling, if it doesn't bond to the tooth, and it expands and contracts over time, just like with ice expanding, won't there be room between the enamel of the tooth structure and the metal filling for bacteria to get down in and cause problems?
They can leak over time, and the biggest threat, though, is the tooth structure. The tooth actually breaking from the stress of the silver filling.
All right, so let's go back to this photo. So we've got the 3 teeth. One has already had the cavity, the filling removed, and the other 2 haven't. So tell me, you sealed the one in the center.
Right, and the whole idea behind dentistry is to preserve tooth structure whenever possible. So with these materials, what you can do by bonding is save the shells of the tooth and prevent crowns from being needed.
So can you give them almost the strength of a crown? Is it close enough? I mean, can they chew on them? And
in a lot of cases, yes. Okay. In most cases.
So let's follow the photos here and get an idea.
Okay.
What's going on here? I see that you've removed the cavities or the fillings from the 2 surrounding teeth, and it looks like, have you sealed both of them also?
Exactly. All the metal's out, and the teeth are covered and sealed again.
Now, theoretically speaking, and obviously from my experience, real life speaking, normally if something goes wrong with that cavity or the metal filling, a root canal is done, which basically kills the tooth. In some cases, they have to grind the tooth down so you lose the structure and put a crown on it. In this case, these roots are now sealed, so these teeth are pretty safe of staying alive for a while and being healthy in there.
That's right.
Okay, so now what happens after this? So you've cleaned out the metal. Are you careful when you clean out the metal?
Absolutely.
I mean, me personally, I was scared because I'm thinking if I swallow that, it's bad enough it's in my mouth, I don't like it there anyway, but if I swallow the mercury, a little kid, my mom scared me to death. If you break a thermometer and the mercury gets on you, you're going to get sick and die. So I'm very afraid of it. So are you careful when you take it out?
I'm very careful. I use a specific protocol for my patients where I protect them while the metal fillings are coming out, being removed from the teeth.
Okay, is this picture we're looking at now, the blue, the rubber dam in there, is that what you do to make sure that the metal doesn't get down the windpipe? Okay.
That's what we use. It's like a raincoat. It's similar. When your head sticks through the parka, your body stays dry. So in this case, your mouth is protected from the material so you don't swallow it.
Okay. Now we're looking at, this is the inlay that goes in the tooth?
Exactly.
It's cut in. All right, and then let's look at the finished product. Wow, that's incredible. Those are the same 3 teeth that you started on with just removing those fillings.
That's correct.
And now those will be good. Those are composites. That's pretty much done and finished with.
Those teeth are finished.
That's incredible. And the smile's got to be much brighter with that in there.
It's very aesthetic. It looks good.
All right.
There's no...
I don't want to move you too fast, but I have so much I want to talk to you about. I want to talk about gum disease.
Okay.
I talk to doctors all across the country. I get the same answers over and over. I talk to you, and at first you scared me, but then I started listening to what you had to say and thinking about it. Gum disease. Obviously, my mom told me when I brushed my teeth when I was little, if I brushed too hard, they would bleed. That's not true, is it? Do they bleed just because you brush too hard? Is that
a sign? It's a sign of gum problems, yes, or gum disease.
Is there any other signs of gum disease?
Bleeding gums, red gums, sensitive sore. If there's any tooth movement for the patient, those are the major signs.
Can gum disease lead to tooth loss over time?
Absolutely. Your teeth can get loose and you can lose them.
All right. The standard, and what I really want to bring up with you is the standard protocol. If you have bad gum disease, and I know people that have it and they don't go in because they're afraid of surgery, the standard with dentists is if you have bad, they do the root scale planing, and it just sounds horrible. And you told me that most of the time you can deal with gum disease painlessly and not requiring surgery. Is that true? And how do you do that?
In my experience, rarely is surgery necessary. I find that I'm able to treat periodontal disease or gum disease conservatively and naturally in my office, and it's not painful. What I do is I actually decrease the inflammation of the gums first, so the gums can heal and respond to my treatment that follows.
You made a comment to me before we were talking, before the interview, that you've actually had patients come into your office that were scheduled for surgery,
Yes.
for gum surgery,
Yes.
and you were able to make it so they didn't need that surgery.
Yes, I have. People were actually scheduled for the surgery. They came to me as a last resort. And they said, "Can you help me?" And I took them through the process. It may take 2 or 3 months or up to 6 months, where we clean the teeth, we give them the products that they need, we give them the instruction, the home care instruction, what they need to do at home to make it work as well.
Do you think people don't get their gums looked at or checked because they're afraid? Maybe they're starting to bleed, or they're ashamed that they've gotten a little... Because I know everybody thinks that all gum disease is caused by poor oral health. Do you think there's people that don't come and get checked because they're afraid or embarrassed that it's going to hurt, or that the dentist is going to chastise them?
I think so. Fear is a motivator. It's a reverse motivator in dentistry. It keeps people away, and that's the problem. If you treat something like gum disease...
Do you practice what's typically called pain-free dentistry? I mean, if I come in and I'm which I am, I'm the biggest chicken you'll ever meet, which is why I did this. I'm looking for alternative answers to going into pain. If I come in and I don't want to be in pain, do you practice pain-free medicine? Can you help me avoid the pain?
In most cases, dentistry doesn't need to be painful. In fact, the purpose of dentistry is to solve pain, get patients out of pain, whether it's gum disease or anything else.
So do you think that most people's fear of pain that keeps them out is unwarranted? I mean, if I'm afraid of pain, can I come in and basically, do you think that that's a fear I don't need to have?
I would encourage that, definitely, because if you wait, it's going to get worse. It could be more painful.
And then it becomes, the longer you wait, the worse the pain becomes to get it fixed?
Yes.
So getting it checked. How often should I get my gums checked?
Every 6 months for most people. It could be a little sooner, it could be later.
All right, Dr. We take another quick break. When we come back, we're going to get into TMJ and the pain that it can cause, and it's an amazing thing to me you were explaining. You're watching Medical News Network. I'm Mike Wittgenstein. We'll be right back.